Well, last month, 3 hunters in Michigan died from heart attacks caused by overexertion while they were hunting. And these unexpected deaths are a reason to talk about the heart health and the signs to look out for that you may be having a heart attack. So here to talk more about your heart health today is Dr. Matt Holland. He's a cardiologist at Denver Health. And certainly it's a really scary situation. You know, here in Colorado, we hear about people shoveling or skiing and having a heart attack then. Who are the people who need to be aware of this and looking out for it?
Well, just about any adult, man or woman, is at risk for coronary artery disease, which is the underlying process that causes blocked arteries and cause a heart attack. Certainly, as you get older, the risk is greater, and there are certain risk factors that we know are most common in people who have significant coronary artery disease, and those include smoking, diabetes, high blood pressure, strong family history of heart disease, and so.
Well, what about the symptoms? What do we need to be aware of? I think a lot of people don't know they're having a heart attack.
That's very true. You know, the classic symptom that we see on TV or in the movies of, you know, oh my God, elephant sitting on my chest, that does occur. But symptoms can certainly be much more subtle, such as a much less painful, but more of an ache or pressure in the chest, frequently in the center of the chest, but it could be on either side of the chest. It can radiate to either arm or frequently to the left elbow, to the throat. Sometimes people present with what they think is a toothache, and it's just aching in the jaw. And certainly there are non-painful symptoms such as nausea, vomiting, sweating, or just overall fatigue.
So what should someone do if they're experiencing some of these symptoms and think they may be having a heart attack, but they're not sure? A lot of people, you hear that, they weren't sure what was going on.
Well, it's okay to have a false alarm. The thing that you should do if you think you're having a heart attack is you call 911. I mean, there are certain other things you can do. You can take an aspirin, not Tylenol, not ibuprofen, but, you know, a full strength aspirin. But really the thing to do is call 911. Don't drive yourself to the hospital. Don't wait to see if it gets better. Because as we say, when someone is having a heart attack, we say, time is muscle. The sooner you get in and you're seen, the more quickly we can then very easily open a blocked artery and restore blood flow, and then you can go on leading a completely normal life.
Okay, great. Thank you so much, Dr. Holland. We appreciate it, and hopefully you can take some of those tips home with you.